The sanitation crisis in Lahj displacement camps is a ticking time bomb, threatening a major public health disaster. The lack of clean water and adequate sanitation facilities creates a breeding ground for waterborne diseases, putting thousands of lives at risk. The Fung Report has more.
The displacement crisis in Lahj, Yemen, has exacerbated an already dire humanitarian situation, with the lack of adequate sanitation facilities posing a significant threat to public health.
Running water is scarcely available. With the absence of working bathrooms, women especially cannot tend to their personal needs at night.
Al-Shawkani camp serves as a stark example of the challenges faced by displaced populations in Lahj. Residents here endure long, arduous waits in front of water tanks, a daily ordeal that further compounds their suffering. The limited number of toilets, often in a state of disrepair, forces people to make difficult choices, compromising their integrity and health. Women and children are especially vulnerable to the consequences of poor sanitation. The lack of privacy in toilet facilities exposes women to harassment and abuse, hindering their ability to maintain basic hygiene. Children, with their developing immune systems, are at heightened risk of contracting infectious diseases like cholera, which can spread rapidly in unsanitary conditions.
More than
500 families compete over the limited amount of water. Disease spread is expanding with water contamination and poor sanitation.
The situation is dire, with displacement camps overflowing. Over 560 primarily households are hosting hundreds more than intended capacity. This severe overcrowding has led to a critical shortage of bathrooms for thousands of people. Unfortunately, there is no room to expand the camps further.
The ongoing sanitation crisis in Lahj's displacement camps has the potential to trigger a major public health disaster. The lack of access to clean water and adequate sanitation facilities creates a breeding ground for waterborne diseases, putting the lives of thousands at risk.